Hope Humana Khanye, in community, we have community-based and focused HIV testing, prioritizing people in high risk and families where a person is living positively with HIV, to ensure that all people who are HIV infected know their HIV status. We refer and ensure that all HIV positive persons register on the ARV treatment program. People testing HIV positive receive TB screening and sputum test if they can't reach to the health facility, referring to those who are presumptive and they are showing signs of TB.
The southern district of Botswana is characterized by vast farming areas by small and big farms. The district is close to South Africa and is home to many former mine workers from South African mines. These characteristics in the district pose a challenge for effective disease management such as HIV and tuberculosis, as some people prefer not to seek health services. 30% of people do not know their HIV status. According to the 2011 AIDS Impact Survey, 1 in every 3 persons aged 31 to 49, the majority men, are HIV positive in Southern District. 1 in every 4 girls did not give consent to sex at their sexual debut. Youth unemployment is high, and some girls are infected by boyfriends who are older than themselves. The co-infection rate of HIV and TB is at 63%. This is one among 7 districts where we operate Hope Humana.
I think the most pressing issues for the community is this stigma. Because you'll find that people do test, and when it comes to them maybe revealing the status to their relatives, irrespective of whether it's negative or positive, people decide to hold on to their test results. But I think now with Humana People to People and this project of the 1990, people will now see the benefit, and the issue of stigma will be dealt with. Because with the door-to-door campaign, more people are testing, other than when people have to go to the testing centers or to the facilities, because not everybody is willing to go to the testing facilities. But with the door-to-door campaign, I think more people are going to be reached, more people will know their status, and I think that's when we can reach the target for the 1990 project.
In Southern District, Humana entered into a partnership with FHI 360 for PEPFAR funds to support the 1990 goals of halting all new infections. Ministry of Health has adopted a treat-all strategy, but need development organizations such as Humana People to People to offer testing to those who are not yet tested, to mobilize the new mothers to have their babies tested, to screen people for TB and secure that all in need into ART and TB treatment. It is clear that there is still more to be done in the fight against HIV and AIDS and TB in the district. The nature of the epidemic has changed and new strategy tactics need to be employed. Humana People to People and USAID introduced the home-based HIV testing program to address the situation.
e re ha ile gore go na le baeng ba bantsi go re mme a reka go ka moring ka gore go mo ke sephiri sa ka go le rona sa rona se re se batla mo go yana ke go batla go bona o tsogile gore o tsogile jang ha ona le bolwetsi re go romela kae ke tiro e ntle tota ka gore ko ba a utse re batho ko dikokelong ba tlhatlhwa ke ditlhong ba itlhabelwa ke ditlhong ke ra le go tsaya dipidisi hela tota ha ba itlhala batho ba itseng ba sia mme ka ha Humana e berekang ka teng gore batho ba ikamogela sengwe le sengwe se direla malapeng mme bile se ke se ratang thata ba boa gape ba tlhola ba go tlhola ba gore o tsoga jang a le gore o tsaya diritibatsi ba go botsa gore o dutlwa jang mo mmeleng wa gago go diragalang hela kore ke batho ba ba tsamayang ga se ba tsamaile ruri mme ntse ba go solohetsa botshelo gore kana anong ha re itlhetse bolwetsi mo go wena ke ga gago le rona le ngaka e tlabeng wa go yone mme bile o tshwantse gore o retse se re se buang gore botshelo ba go le yone tle bo tshwane jo mongwe le mongwe ga ba go tlogele hela ba gore ba go tlhatlhubile kampo ba buile le wena ba boantse ba go tlhola hela ga se batho ba ba tsamaelang ruri.
Hope is a unique and systematic approach to empowering communities in fight against HIV and AIDS and TB. The aim of the program is to reach all persons who are HIV positive but are unaware of it in an operational area of 50,000 people through door-to-door campaigns, individual counseling, and community mobilization. Hope starts by mapping and target areas with the highest rate of HIV and families where one member has just tested HIV positive. The HOPE program works closely with clinics and other local stakeholders to secure that those who test HIV positive are linked to care and treatment, and people screened for TB and suspected to may have TB are referred for TB testing.
Basically, what we have realized, we have issues of TB patients defaulting from treatment, and we have lots of follow-up of people on ARVs. Basically, door-to-door testing done by Humana, that is helping us much in the sense that they pick up patients in areas where we could not reach them. That in the case will reduce morbidities by people getting earlier treatment.
11 trained outreach officers are working in Khanye and Moshuba towns. Hope is founded on the philosophy that only the people can liberate themselves from AIDS, the epidemic. Humana People to People would like to thank the passionates, the dedicated Hope outreach officers, and the Hope leadership as they have taken their tasks to heart. The motivated outreach officers and the people is the key to the success of Hope Humana and the Advancing Partnerships and Communities program. And lastly, we would like to extend our gratitude to our partners, the Ministry of Health and national and district level, the Chiefs and VDC, USAID, FHI 360, Baylor and Bonepra for their valuable contribution to the fight against HIV and AIDS epidemic.